Hello, friends. So, very good morning to all of you. So, today I've got a few suggestions for the candidates who are in the last month of their preparation, mainly for the Section 1 candidates. Usually, a candidate spends around 3 to 6 months of preparation time, and during this time, they have gone through multiple sources and they have highlighted important points from different texts and different guidelines. But the problem that happens to most of the candidates, including the problem that I have faced in during my preparation time, is the last month revision problem. Okay, so what happens during the last month actually, or the few days before exam, we start losing our interest. We find it difficult to focus on a particular topic. We usually take more than usual time for completing a topic than what we should be actually taking, and we start losing our pace. So there is a few suggestions which I think all of you should consider it at least a few days before your exam. Number one is don't overburden yourself with a lot of new information. There is always an urge to learn, to revise, to study from different sources. You might be finding new publications coming out, but it's not technically humanly possible to go through every new information that you are getting. Trust whatever you have compiled over the last few months and stick to revising those information first. Number one, you have to stop the urge to keep learning new things at least few days before your exam. Number two, what I always keep on saying is you need to do an analysis of your strength and weakness. Most of us find that there are certain topics that we don't feel so much confident into. There might be a topic like transplant, there might be a topic like immunotherapy or maybe infertility, which we might feel, okay, I'm not so confident into this because I don't practice this much. There might be certain topics which you might feel that you need to revise more, you need to study more, and probably you need to open text for them and revise from there. Do an analysis and find out those topics. Sometimes you might realize that certain topics you might not have touched at all, probably because you are scared of reading that topic. Probably you don't find that topic interesting. Don't leave out any important section, at least completely, before you go for the exam. So at least you should have an idea about what are the questions that can be framed out of a particular section. So this is going to be really helpful. Please don't leave out any particular section completely. You will be finding very difficult. You might find 3 4 questions which are you totally don't able to answer at all. Number three, I understand it is always very difficult to maintain the focus. When you are reading from the same source every time, it becomes difficult to concentrate and you start losing your interest and you start feeling either pseudo confident or you start losing your confidence. You have a lot of mixed feelings whether you will be able to crack or not. So to get rid of all this, you need to keep yourself in touch with some modules, some bit of information, some bit of questions, and you keep solving them. I'll tell you what you can do for this. So there is a resource which is available online. You can go through the resource which is known as the BJU resource. I think most of you might be aware of it. I'll show you how it works and how you can utilize this resource a few days before your exam or in the last month at least, how you can use this. So this is the BJU resource. You need to log in. Once you log in, you get to see there are a lot of modules in oncology, pediatrics, infertility, andrology, female urology. So there are a lot of modules you will be coming across. Before that, go to the question banks. You can see there are 5 to 6 question banks which are available, and every section has got around 30 questions. You should be able to go into them, try to open the test and go through the questions. Okay. When you go through the questions, you will realize these are clinical scenarios. This is what the exact exam pattern is going to be like. You're going to get a clinical scenario with 5 options, and one is going to be the best answer. So once you go into this, click on start, and you will get to see the clinical scenario. So you can select an option which you find most correct to you, and there are 30 questions. What I would recommend is set a timer, take this as a mock exam. Don't relax, just take it casually, take it as a mock exam, okay? Because the real exam is going to be a clinical scenario. They will give you an image and they will make a clinical scenario. So this is one of the very easy source of revision, and it will help you to keep your interest in the last few days of your exam. There are certain modules available as well. Now, what you can do is there are different topics in different modules. There are 400 topics, okay? So it's not possible for you to go through all of them, and it's not necessary at all. There are certain topics, again, which you need to revise more. Suppose you need to revise more on the 5-alpha reductase inhibitors, you need to revise more on the immunotherapy, or infertility or whatever be it. So just pick up your weak points. Every module has got around 20 slides. Okay, they're PowerPoint slides and they have very few words in them. Don't think there are a lot of information. It's not necessary to go through all of them. Whatever you feel like you need to revise more, go through them. Second thing, when you do these modules, there are certain questions in the module at the end of them. So self-assessment is possible. These questions are also clinical based, and so they will also give you some idea about how a particular topic to be approached. Okay, so this is going to be really helpful. It's not mandatory to do it, but when you are losing your focus in the last month of your revision, this is going to help you to keep focused. One more trick I would like to tell you: when you go through this question bank, there will be around 150 questions altogether. Okay, so when you mark a particular option correctly, you will realize that they won't give you any right answer for that. But if you mark a particular option incorrectly, then you will get a solution and explanation for that. This is important, particularly if you want time and you want to revise. Then once you have done all the questions, you can go to the question, intentionally mark as one of the options incorrect, and then you go and look at the explanation. You want to see the explanation of a particular question. This is only if you want to know something about a question which you are not very sure on. This is going to help you, particularly in your last few days, and trust whatever you have studied, trust your resources. Nobody is reading anything extra. Okay, what you are preparing, every candidate is doing that. Trust the concepts that you have, with all the concepts, with all the knowledge. If you are able to just revise them before the final exam, at least once or twice, you will be able to do well. So all the best. Hope you find this really useful. Thank you.